Hello, good morning. My name is Counselor Missy Kaimer from BSN 212F, and today I will be performing the perineal flushing. So perineal flushing is a hygienic care that involves the cleaning of the perineum and the genitalia. So prior to the procedure, we have to prepare all the necessary materials and also to wash our hands. This is to save time and energy, and also by washing our hands, we can be able to deter the spread of microorganisms. So prior from going here in the room, I had already washed my hands, and so I have already prepared the necessary materials. So the necessary materials are the following: our working gloves, a pitcher with a warm water, a cotton balls which will be used later on, antiseptic spray, the cleaning solution, two forceps that we will be needing, the working forceps and the pick-up forceps, and then the new underwear of the patient, the perineal pad, and also the bedpan that we are going to put in the buttocks of the patient. So now we are going to explain the treatment to the patient to let the patient understand the procedure and also to gain the patient's cooperation. So hi ma'am, good morning. My name is Counselor Missy Kaimer, your student nurse for today. And today ma'am, may I see your wristband first? Can you state your complete name ma'am? Okay, and your birthday please? Alright, so how would you like to be called ma'am? Okay, so ma'am Rose, is the temperature in the room okay for you, or do you want me to adjust it? Okay, it's alright for you. So now ma'am, what I am going to do now is I will be cleaning your private part, and because since you had just delivered your baby, we will be needing to clean it so that we can be able to flush off all those secretions or those turds that have remained in your vagina. And so because those secretions ma'am, and just like the blood that had already hardened during the delivery of your baby, needs to be cleansed off, because this will prevent you from having any infections, and also to help you to help promote healing with your perineal tear. Okay ma'am, would that be alright to you? Alright, so now we are going to screen the patient or lock the door of the patient's room. This is to provide the privacy. So now ma'am, let me just screen you so that we can be able to proceed with the procedure and also to provide you with some privacy. Okay. So now I am going to position the patient on a dorsal recumbent, and also afterwards I have to be putting the bedpan under the buttocks of the patient, because this is to provide comfort of the patient, and also by putting the bedpan in the underneath the buttocks of the patient will prevent the bed from becoming soiled. So now ma'am, let me help you in flexing your knees. So let's start with your left knee. Okay, and your right. Alright, so now ma'am, I'm going to put the bedpan. So I will be going to help you lift your knee in a count of 3. Please lift your knee, okay? Okay. So 1, 2, 3. Please lift your knee. Alright, I'm going to put this. Okay, thank you. So now I am going to drape the patient, exposing only the parts that needed to be cleansed, because minimum exposure of the body parts will lessen the embarrassment of the patient and also will help to provide warmth. So now ma'am, I'm going to roll up your blanket, and don't worry because I will only expose those necessary body parts that I will already clean. So allow me to roll it up for you. So now what we are going to do next is we have to flush the perineal area with some warm water, because warm water will help us to prevent chilling, and also will dissolve the blood clots that already hardened. So this is our warm water. Now ma'am, I'm going to flush your private part with some water, but before that I am just going to wear my gloves. So now, ma'am, I'm going to pour this warm water in your private part, so don't be shocked. So now what we are going to do is we have to get the cotton ball soaked in a cleansing solution using our pickup forceps. This is to maintain sterility. So this is our forceps, pickup forceps, and we are going to get 9 cotton balls and soak it with a cleansing solution. I will get 9 cotton balls because since we are going to also clean the buttocks of the patient, especially if there are many secretions that had gotten into his or her buttocks. And so I will also get another 9 for the dry cotton balls, because after cleansing the private part of the patient, we need to dry it up. So now we are going to cleanse the internal genitalia, starting from the midline of the symphysis pubis and we down to the anus, and we should always remember that we should never retrace a stroke. This is to prevent any contamination in the area. So now, starting from the mons pubis down to the anus. So this is our the symphysis pubis, starting from our symphysis pubis down to the anus. Never retrace a stroke, then discard it. And then next, for the second cotton ball, we have to start from the mons pubis in a figure of 7, from the mons pubis in a figure of 7 into the labia majora. So we have to start from the part that is far from us. Okay, from mons pubis in a way of 7 and into the labia majora to the anus, and then discard. And the next is do it to the other side, from the mons pubis down to the labia majora and into the anus, and then discard it. And the next is we are going to start with the mons pubis in a form of 7 and into the labia minora up to the anus, and then discard. So by doing this cleansing or procedure, we are preventing from contaminating the area, and also by preventing any bacterial growth. So from the mons pubis to the labia minora and to the anus, and then discard again. And then now for the another cotton ball, we have to clean the groin growing up to the thigh. So after doing it in the far away side, we are going to do the same in the near groin. Okay, so from the groin and into the thigh in a zigzag motion, and then discard. And then to the other side of the groin and into the thigh in a zigzag motion, and then discard it. So now we have to flush the perineum thoroughly with a sterile warm water, because washing off the discharge from the perineal area will help us prevent any bacterial growth and also will cleanse the private part of the patient. So now, ma'am, I'm going to flush again your perineal area with a water. Now, using our dry cotton ball, we have to dry the perineum with the same stroke as earlier because any moisture will support the growth of many microorganisms, and also this will may result into any infections that may happen in the perineal area of our patient. So it is very important that we have to dry it up. So doing the same thing as earlier, we are going to start in the symphysis pubis down to the anus, and then never retrace the stroke, and then discard. And the next is from the mons pubis in a form of 7 down to the labia majora and down to the anus, and then discard. The next is from the mons pubis down to the labia majora in a form of 7 and into the anus, then discard. Then next, from the mons pubis in the form of 7 and down to the labia minora and then to the anus, and then discard. And then to the other side, from the mons pubis down to the labia minora and then to the anus, and then discard. And then now, from the groin and into the thigh in a zigzag motion. So from the upper part of the groin down to the groin, lower part of the groin, then in the zigzag motion to the thigh, and then discard. Then again, from the groin in a zigzag motion up to the thigh, and then discard. So now, since we are done drying up the perineal area of the patient, we have to remove the bedpan gently and then turn the patient to the other side because we have to see if the buttocks has any secretions that we have to clean. So now, ma'am, I am going to help you in lifting your hips again so that I can be able to get the bedpan, okay? Okay, in a count of 3, ma'am. 1, 2, 3. Please lift your hips. Okay, thank you. So now, ma'am, I'm going to help you to turn on the left side so that I can be able to see your buttocks, alright? Okay, so please turn to the left side, ma'am. Okay, slowly. Okay. So allow me to roll up your blanket, ma'am, so I can be able to see clearly your buttocks. Okay, thank you. So now, if we observe some dirt or secretions in the buttocks, we have to use the remaining 2 cotton ball that is soaked in a cleansing solution, and also the 2 dry cotton balls which we are going to cleanse, which we are going to use in cleansing and drying up the buttocks of the patient. So since I have observed that there are some secretions in the buttocks part of the patient, we have to clean it, since the patient had undergone a delivery. Okay, so now, ma'am, I'm going to clean up your buttocks, starting from the inner up to the outer part. Okay, discard, and then to the other side. Okay, and then discard. Now we have to dry it up using our cotton ball in the inner. Okay. And then inner. And discard. So now we have to turn the patient on her back and make her comfortable. Okay, ma'am, now I'm done cleaning your buttocks, ma'am. You can now lay down and go back to your original position slowly as I am helping you. Okay. So let me just cover you with some blanket, ma'am. Okay. So are you feeling comfortable with your position right now, ma'am? Okay, that's good to hear. Now we have to spray with antiseptic because since the patient has just delivered her baby, she had a acquired some perineal tear, and so by spraying some antiseptic, it will promote the healing and also will fasten the healing of the perineal tear of the patient. So this is our antiseptic spray. So now ma'am, since you have acquired a cut in your vaginal opening, ma'am, I am going to spray this antiseptic spray so that it will fasten the healing of your wound. Okay? Okay. Alright. Now we have to put the perineal pad with an up-down motion as needed because this will prevent any contamination of the vagina and urethra from the anal area, since our anal area is the dirtiest part of the private part of the patient. So let me just get this picture so that I can be able to insert the perineal pad to the patient. So now ma'am, I will just roll up your blanket again now, so I can be able to wear the perineal pad in your private area. Okay? So from here, we have to up down, do the up down motion like this, the up and to the downward. Okay. And then we are going to let the patient wear his new underwear. Okay naman, with your legs, so I can be able to insert your underwear into the other side. Okay. Please lift your hips. Okay. Okay, thank you. So let me cover up now so that you can feel comfortable and so you won't feel any coldness. Alright. So now we are going to do the aftercare of our materials to prevent any cross-contamination. Since we are done cleaning the perineal area of our patient, we can now discard our gloves. So we can now discard everything and open it. So now, next thing we are going to do is to record the treatment done to the patient and also the discharges that we have observed during the cleansing. So this documentation purposes is for some evidence that the procedure was done to the patient and also a means of communication among healthcare providers. So now let me just get the record. Now I am going to type the information of the patient, which is her name, her birthday, age, and so on. And also the procedure done, which is perineal flushing. And during the procedure to my patient, I had observed that there are no inflammation or any swelling in the perineal tear of the patient. However, there are some secretions such as blood clots that some had already hardened and some are still being secreted. And also, there are no any bad odors that is being smelled in her private part. And also lastly, there are no any sign of infection in the perineal area of the patient. So we can say that the patient doesn't have any infection. Right, so now we are done with our procedure. We can now say goodbye to our patient and thank her with her full cooperation during the procedure. So now ma'am, since I am done with cleansing your private part and I had observed nothing, no signs of any infections, I just observed that there are some secretions which, like for example, the bloods that had been secreted through your vagina during your delivering of your baby. So I had already cleansed it, and as you can see, or as you can feel, that you are already feeling warm and comfortable in your area, private part. So now I'm going to ask you, ma'am, before I leave you with here alone. Is there any concerns or any questions or any request that you want to ask me, ma'am, or you want me to do? Do you want to go to the comfort room, or do you want to sit down, or anything that you want to do, ma'am? Okay, none. So would you like me to adjust the temperature for you, ma'am, before I go out? Okay, none. So since you don't have any requests now, ma'am, or any concerns, I'm going to let you rest, and I'm going to go to the nurse station. Okay. Alright, so thank you for your cooperation, ma'am, during the procedure, and now I will let you rest. Okay. Okay, so that's all, ma'am. Thank you.